If you fail to achieve 5 successful inflation breaths, check the size of your face mask. A poorly fitting face mask could result in ocular pressure, which could cause vagal stimulation. Once you're happy that your face mask is fitted correctly and is the appropriate size, ensure that you did not ventilate your patient too quickly. This can result in failed ventilations. Having achieved neutral alignment, you could now attempt a 2-person jaw thrust technique in order to achieve successful inflations. Next, under direct vision, inspect the oropharynx. If there are any obvious obstructions, such as thick particulate meconium or blood clots, you could consider suction at this point. Whilst in this position, you could also consider inserting a correctly sized OP airway. If you have still not managed to achieve 5 successful inflations despite these interventions, consider inserting a correctly sized eye gel. By now, you should have achieved 5 successful inflation breaths, and you are in a position to progress further through the algorithm. After 30 seconds of ventilations and commencement of 3:1 resuscitation, consider preductal SpO2 readings by placing the sensor on a finger of the right hand. In order to achieve target saturations, introduce low-flow oxygen and reassess at timed intervals as per the algorithm. When using a supraglottic airway or BVM at this stage of the resuscitation, utilize end-tidal capnography. The values are unlikely to correlate with adult and pediatric guidelines, but they will provide evidence that gaseous exchange is taking place.
Key learning points. You must achieve 5 successful inflation breaths before moving further into the algorithm. Adopt a stepwise approach. SpO2 monitoring should be preductal. End-tidal CO2 monitoring is a low priority, and values vary from adult and pediatric figures.